My name is Joseph Dayan. I'm a plastic and reconstructive surgeon specializing in facial paralysis, and I work at the Institute for Advanced Reconstruction.
Chris Lakhiani. I'm also a plastic and reconstructive surgeon. We're trained in reconstructive microsurgery, and we work for the Institute of Advanced Reconstruction, treating patients with all forms of facial palsy.
I think one of the most important things is understanding what we're doing, because facial nerve reconstruction can get a little complicated. It usually involves multiple steps, and that can take several years to complete. Once the facial nerve is cut, it's never exactly the same when you reconstruct it, but you can get a lot of function improvement and all around. I think the fact also that we have a partnership, and it's not just one surgeon, but two surgeons collaborating together, both for us and for the patient, it's better. Having an extra pair of eyes, there's always going to be something somebody sees that the other may not pick up. And just in medicine, I think it's good to have, you're not just getting two people, but we speak with our colleagues. And so there are multiple hidden eyes on you backstage because we think of every case individually. We also will show our results, have an extensive experience. We both have an extensive experience in facial paralysis, and we can actually show you a patient that's similar to you and what their outcome was. And I think it's very important for anybody embarking on a surgery to have a clear picture of a realistic outcome and understand, is this something that makes sense to them?
Yeah, I think that's great. And to piggyback off of that, all patients should expect when they come in, when we sit with you and after we examine you, we actually display a whole presentation that talks about facial paralysis, how it pertains to them, what the treatment options are.
I'd like to just also add that in facial reanimation, typically the smile is the focus of everything, and clearly a smile is very important. But we're not focused just on the smile. We really are focused on pan-facial reanimation, moving the whole face, closing the eye, moving the lower face, moving the lower lip. So our toolbox is not limited to just making a smile in one vector. It really includes closing the eye. It also includes lower lip motion and depression. And in cases where there's a central tumor in the brain that's affecting sensation to the cornea, where there's a high rate of vision loss and blindness, we can also restore sensation to the cornea. It's not enough just to be able to close your eye. You need the blink reflex to know that there's a small particle there to protect your vision and wash it away and constantly lubricate the eye and blink for dryness. So we're always looking to go farther and better to approach normal.